Hi, everyone. This is Sonja Robinson hosting the Sun Talk Radio Show, Sustainable Urban Network, Saturdays at 3 p.m. on GODRadio1.com for us to scale up our neighborhoods.
Tune in to Sun Sustainable Urban Network Talk Radio Show on GODRadio1.com. Get up, get out, and get green. You can't let Earth pass us by. We got to scale up our neighborhood, y'all.
Hi, everyone. Welcome to another day in Sun, Sustainable Urban Network. Happy Sun Saturday. You could be anywhere, and we appreciate you tuning in and hearing our show today. And we have a fantastic panel of our professional healthcare Avengers fighting on your behalf during this pandemic, wanting to make sure we stay healthy and safe. And so we will be discussing this topic and diving in very quickly. We also wanted to say thank you for tuning in. Drop us a line. Let us know where you're at. What city, what state are you representing? We invite you to join our discussions. If you have any questions or comments, feel free to leave them. Here at Sun, we address forward-thinking, action-driven behaviors that seek the best outcome for our communities that have historically been left out of our society as decision makers, left out from being in front of the table or at the table for our frontline communities. Today, again, we have this wonderful panel that we can't wait to dive in because our health matters, our health justice matters. So we will talk about real quickly, we're going to give our reflection, have our sun enlightenments, give a couple Sunshine Award shout outs, as well as who is the fossil shade, give some announcements, and then we're going to dive into this topic. So our reflection, I think, is very appropriate for today's topic is if we are going to be part of the solution, we have to engage the problem. And that's by Majora Carter, and she is a sustainable shero in her own right out there in the Eastern Seaboard in the Brooklyn area. So now for our sun enlightenments. As we do in every show, we give reference to the inspiration for them from our modern thought teacher, Don Miguel Ruiz. And our sun enlightenments are as follows. 1, be responsible with your resources. 2, take the state of our environment, our health, and our social justice seriously. 3, don't wait for no one else. Do your part. And 4, when you do, give it your best loving effort from your heart. Now, on to what's happening. Okay, so as I mentioned, we got this panel of some serious health Avengers here, giving it up for some Black women magic. And I mean, women are making some strides left and right. Me personally, I can't get over I'm still elated of having our very first Vice President of the United States, Miss Kamala Harris. So got to give it up to her. And so, as well as her, as we know that our first FLOTUS in many decades, Mrs. Jill Biden, Dr. Jill Biden, she will be the first paid First Lady FLOTUS in many, many, many decades, showing that you can have it all. So we got to give it up to her as well. Now, did you guys hear about that other women power happening with Miss Kim Ning? She is the first woman to be a general manager of the Major League of Baseball. So, and that's with Miami Marlins. I mean, women are making some strides left and right. And again, I got to give it up to our current panel as well, because they are putting in some serious work. Matter of fact, this week is Happy Nurse Practitioner Week. And so we want to give it up. We got two very famous in their own right, making it happen right here and throughout San Diego County. So we got to make sure we shout out Miss Danielle Gordon and Miss Joanne Goode. Happy Nurse Practitioner Week, because you are doing it. Thank you guys very much. Yes, Dr. Afllalo is giving up hand claps, and I'll give up some heart love. So now, as far as another announcement, so our nurse practitioner, Ms. Danielle Gordon, wanted to make sure that we know that there is a food grab and go every Tuesday at the Jacob Center. So you can look on our post, on our Facebook post for the flyer, and make sure that you participate. Make sure you grab and go, get some, resources, get some nutrition, things that you may need. Also, I am so happy to hear that you know our Shiro hero. I'll give her introduction when I introduce our panel, but she has been doing so much work here in our community. And so very soon we can be expecting her and Miss Wendy Schultz will be reopening the Community's Health Resource Fair that has been in our community for several years. So we're looking forward to that. And Dr. Afllalo wanted to make sure that every one of our listeners, as well as our viewers, know that there are some community health worker positions with SDSU. There's COVID tracing work positions and others. So we want to make sure that our community is aware and know about these other job opportunities and careers. Now, Sunshine Award nationally, again, we got to give it up to our first Vice President, Miss Kamala Harris. So she definitely get our Sunshine Award. Locally, so you guys know I've been working on this franchise agreement for the city of San Diego. So definitely got to give it up to our city council president, Miss Georgette Gomez. She made a bold leadership decision in making sure that our city council moves forward with an extension. So our assessment of what our energy future is done appropriately. So we got to give love to our council president, Georgette Gomez. Had an opportunity to meet with her just yesterday. And so we got to make sure we show her love and that she did the right thing. Now, on to the fossil shade. Well, in opposition of our council president's decision, our investor-owned utility, SDG&E, pushing back on that extension gets the fossil shade because literally they are investing in fracking and in fossil fuel, which we know is bad for our health. So right now we're going to dive into our topic, our health, the pandemic, and the environment. And so before I introduce this, fabulous, professional, top of the crop panel, we'll listen to our topic theme song, and then next I'll introduce this wonderful panel and we'll dive into some questions and discussions related to our health, the pandemic, and the environment. All right, so we are looking for a healing. Our county, our country, our state, the world is definitely looking for a healing. And I know that our most fantastic, as our engineer behind the scenes said, our hero, Shiro, Dr. Suzanne Afllalo, is just that. She is a community champion. She wears her heart on her sleeve. She really does provide services beyond the call of duty. She looks to mentor and help so many of us in our community. And so just to give a peek a little bit about her, she's a family physician. She's born in Kingston, Jamaica. She worked at Kaiser Permanente for over 20 years and retired just a few years ago. And she's told me many times that she works harder now, retired, than she did when she was working. So she is currently served as a medical director for Alliance Health Clinic, which provides healthcare for refugees in our community. She serves on many boards throughout our county, including the County of San Diego's Health Services Advisor. She's the vice chair. She also serves at the University of California, San Diego Chancellor's Community Advisor Board. She's also part of the San Diego Black Nurses Association Advisory. She's on the COVID-19 Equity Task Force and Regional COVID-19 Task Force for Equitable Recovery at SDSU. And she's at the SDSU's Community Advisory Board fighting COVID. She lectures on health, breast cancer, diabetes, high blood pressure, heart disease, and many other health topics that really impact our communities. As well as she's a founding discovery of Healthier Me, which is a nonprofit organization that seeks to increase our health outcomes in our church communities. She's completed her family medicine residency at Kaiser Permanente Medical Center in Los Angeles. Dr. Afllalo serves as chief of the family medicine department for 6 years. She's taught numerous medical students and residents as associate faculty at University of California, San Diego School of Medicine. She has a trophy case of numerous awards, rightfully so, to include just a few. Dr. Susan Afllalo Day by the City of San Diego, which is in December 14th. She has also received awards from the Live Well San Diego Public Health Champion Award, Voice and Viewpoint Jerry Warren Humanitarian Award, and one of San Diego's top doctors for 7 years, Kaiser Permanente's Family Physician of the Year, and so many, many more. I think it would take up more than an hour just to read all her accolades. Thank you. Welcome, Dr. Afllalo. We also have Ms. Joanne Goode. She has been a nurse for nearly 20 years. She's also an advanced practice nurse for 3 years. Her focus is disease prevention, and within her career, she received her RN diploma from Frankfurt Hospital School of Nursing, her Bachelor of Science of Nursing from Thomas Jefferson University, located in Philadelphia, Pennsylvania. She's received her Master's of Science Nursing from Azusa Pacific University in California. She is a member and operates on ministry team and as a founder and leader of the Health and Wellness Ministry at New Vision Christian Ministries in Vista, California. Her care philosophy is centered around patient education and treating patients as if they were family. Her mantra is, an educated patient has the best outcomes. Welcome, Ms. Joanne Goode. Last but definitely not least, we have Ms. Danielle Gordon. She is a board certified family nurse practitioner in San Diego. She is the owner of Innovative Wellness Clinic, a nursing corporation that serves for new primary care that is set, her office is set to open hopefully next month, but definitely soon. So make sure you keep your eyes open for the Innovative Wellness Clinic. Welcome, Ms. Danielle Gordon. So as we're, looking at what's happening, I mean, there's a lot happening. And before we go too deep of a dive, what my question is, what would you say could be an avoidable health risk as we consider our lifestyle and our environment during this pandemic? Dr. Afllalo?
Great. Thank you for having us, all three of us here today. I would just have to say that the most important thing is staying healthy, keeping your own immune system healthy. And that doesn't start today. But if you haven't been doing it all along, it's not too late to start, which means obviously making good choices in eating, healthy foods, nutritious foods, getting the rest that you need, doing some exercise, and really trying to avoid anyone that's sick. So since we do have these measures that have been in place in terms of putting on some kind of facial covering, washing your hands and keeping your social distance, those things actually help to decrease any kind of infection spread. But also, since we're in cold and flu season, that also helps to decrease the flu exposure too. So at this point, it's really about trying to keep yourself healthy as you can, so that if for some reason you are exposed, that the outcome may be minimal if you're healthy and your immune system is strong enough to fight it off.
Thank you so much. I appreciate that. Joanne, do you have any thoughts on any actions we could take that could be avoidable for our health risks as we're considering our lifestyles during this pandemic?
Well, again, the topic at hand is prevention. So how do you prevent getting sick? You stay away from people who are sick. If you are sick yourself, please don't go to work. I can't stress enough how important it is for you to think of others. I understand we don't want to miss our employment and finances, but thinking of other people outside of yourself. So stopping the spread by, if you're sick, stay home. And also, if you wash your hands, cover your face, and stay at home, these are the things that we can do that are avoidable. But also, healthy eating, supplements, like vitamin C and zinc are also really good for you, especially during cold and flu season. Eating healthy and making sure that, again, you are thinking of other people. I just can't stress that enough.
Thank you. Danielle, do you have anything you would like to add as well, or did Dr. Afllalo and Joanne kind of cover it?
Oh, yes. Thank you again for having us. And
yes,
they covered a great deal. I want to also add, this is also the time to make sure that we are taking care of our health, but just getting our checkups. A lot of times our patients are a little bit more afraid to come into the office to get a blood pressure check or to check in on their diabetes. And this is absolutely not the time to let those things slip away and not be well in control. Additionally, I would say everyone needs to check their vitamin D levels. We know that vitamin D plays a huge role in immune health, and we need to know what level of supplementation to prescribe for our patients to give them an optimal chance to fight COVID if they were to come into contact with it.
I appreciate you mentioned that. I know many, many years ago, my vitamin D levels came out very, very low, but also they said it's because the standard ended up, increasing significantly. And so I haven't been taking my vitamin D. So
the vitamin D.
I want to make sure I do just that. So now I want to ask this question. I want to let our nurse practitioner, Joanne, I want to, definitely aim this question to you. When we're looking at our health and the environment, can you explain how healthcare and our environment can impact the standard of our lifestyle, such as our air quality and how poor air pollution can really harm us, right, and be a risk factor in our livelihood?
Thanks for asking that question. I split my time between Imperial County and San Diego County. And in Imperial County, known as having one of the worst air qualities in the country, we see a lot of people who have chronic conditions like asthma, seasonal allergies, COPD, that are definitely impacted by the environment, whether it's air quality or allergens in the air or just upper respiratory conditions. Those people can be negatively impacted by just regular things like cold and flu, but also with COVID looming. So one of the things, is really prevention again. So if you know that you have one of these chronic conditions, this is not the time to skip your medications. It's not the time to skip even regular homeopathic remedies that kind of take care of things like seasonal allergies, changing your air filters at home, making sure that you vacuum, that you keep the windows closed when it's windy outside, just to kind of prevent those things that are the triggers to those things. So taking your medication, prevention, and doing the things that you need to do to make sure that you keep those conditions under control.
Thank you. So I've already got reminded on both, my vitamin D, and now I forgot I needed to change my air filters. So I hope our listeners are also being able to take these tips to heart. And, so Dr. Afllalo, I would like to ask you, because I've heard this chatter and, some of the conversations I've been in, and of course, not being in the medical field, just a little less, lot less, experience to answer it. But can you explain to us the difference between what a pandemic is, which we are in now, versus an epidemic? What's the difference between those two?
Well, an epidemic is going to be more local. So it can be in a community, it can be just in our country, but a pandemic is worldwide, it's global. So there isn't one piece of this earth that isn't affected with it to some degree or another. Whether it's even in my home country in Jamaica, there's a small outbreak there, but nonetheless, it's not nearly as significant as in the United States of America, which is the worst place where the pandemic has hit, because we're not taking sensible national measures to keep this virus under control. But there are other countries that have done wonderful job, like in Taiwan. They have very little to no cases. New Zealand, because they were smart. They had good leadership. They did the right thing at the beginning and they got control of the virus. The virus needs somewhere to go. And if we stay away from each other and all mask up, then we could get rid of this. But because we have a fraction of our population that refuses to consider, as Joanne said, consider each other that we are actually a community. If you have a population that's refusing to mask up, then you expose everyone in your general area that's going to be affected. We'll never get this pandemic under control in our country if we don't start doing the right thing. So we're looking forward to new leadership. I know it's going to be hard because we've already wasted 9 months of one city here and one state here doing some good measures, and then the other states that are just being inappropriate in their behaviors that now, and people don't stay in their one little communities, go to other places, they travel and they bring that with them. And so without being political, going to places and having rallies and everyone comes together and then goes back home to their cities and states, now spreads it to those areas. So epidemic is going to be more local, one area, but a pandemic is global and worldwide.
Wow. Thank you for that definition, because I was not aware of that. So you're saying that the politicizing our health is causing more risk factors for us. Did I hear you right, Dr. Afllalo?
Yeah, absolutely. We actually could have had this under much better control had we done the right thing from the very beginning when we were advised that this was coming our way back in January. Had we done the right things in the first few months when we actually, some of us did lock down, stay home, this thing could have been history behind us. And then we would have had time to get the vaccine together. And if we continued to wear masking, then that would have continued to prevent the virus from spreading. So I give you an example of Taiwan. If you go there, you have to quarantine for 14 days. I don't care who you are. You stay in a hotel, you're on an app. So, we have more leeway in this country, but you have an app, they call in to you twice a day and your butt better be there and you better answer. And then after 14 days in a hotel room, then you can come out and everybody wears a mask. And that's why there's pretty much zero outbreak. And same thing with New Zealand. Plus they also kind of stopped some people in certain countries to even come in so that they could just get control of it in their own country and then allow people to come in and do the quarantining. So we just got it all wrong from the beginning, but that was from poor leadership.
Right. Now in Thailand and New Zealand, from a even environmental perspective, they're totally two different, types of environment, climates and everything. So, we're going from almost one extreme to the other. So Joanne, I saw you shaking your head. Did you want to share any thoughts on what Dr. Afllalo mentioned? We're all family here.
Well, I think that if we would all consider other people, some of the African countries, I was just watching on the news this weekend about how they have taken control based on prior epidemics in those regions and how they know how to handle it. I think, again, leadership didn't do us any service by trying to hide the facts. But with that being said, now that we know better, we can do better. Right. And I think that if we all get on board and even take on the difficult times that's going to come ahead with the new leadership, I am imploring everyone to just get prepared for a potential lockdown. So, getting supplies and making sure that you're prepared. I anticipate that probably is going to happen. But I just think that making sure that you are considerate of other people. I just can't stress that enough. I quarantine myself on a regular basis because of my risk. And I could not even think of how badly I would feel if my asymptomatic self took this condition to someone that I loved, a grandparent, a parent. So I just think that, being cautious and considering other people is going to be the key.
Thank you. Danielle, did you have any other thoughts on that? Because I definitely have the next question wanting to go straight to you.
Sure, we can go to the next question.
So when we were talking earlier, I think you made a comment about how does seasonal sicknesses, right, affect or impact COVID-19 as well, like flu, cold, things of that nature. Can you kind of start us off on that discussion as well?
Absolutely. So the concern, especially now, we're in flu season, and a lot of the symptoms that are similar between flu and COVID. So as providers, we have a hard time differentiating between the two when the patient comes in with symptoms. They're both terrible. We're starting to see both of them happening in the same patient, which is a double whammy. So we have COVID, which wreaks havoc on the entire body, but especially on the lungs. And then we bring in flu, which can also severely impact the lungs. We added pneumonia on top of that. It's no question why we're seeing terrible death rates, terrible. And I just want to say this too. I know that a lot of us feel that, oh, I can fight off this virus. I'm okay. I'm healthy. And we're seeing a lot of young, healthy people going into the ICU. The ICU is not a ballpark. I've worked in it. It's not easy. Being on a ventilator, having a machine breathe for us, being sedated so that we will allow the machine to work for us, having nurses, 3 or 4 of them at a time, physically turning our body so that we don't get bed sores, so that we can move air throughout the lungs. It's a big deal if we can discharge someone out of the ICU. And so when that happens, there's a huge impact in terms of the rehab that has to be undertaken when someone hasn't been moving for several weeks or months because they've been fighting this virus. So this is just not a game. We all have to get serious. In San Diego, we've moved into the purple tier. It's time to start hunkering down. Like everyone's been saying, we have to do what's best for the greater good. No more selfishness. We have to get this under control.
Wow, I didn't even think about like occupational therapy or other type of, therapies with this. So Dr. Afllalo, I also have a question. Can you kind of enlighten us about like, what's the difference between COVID-19, if you will, and other upper respiratory, infections, as Danielle mentioned, like, she just mentioned it, but other, bronchitis, I guess, is one. So, bronchitis versus COVID-19. Can you kind of share some differences on that?
Yeah, I mean, as Danielle mentioned, this is cold and flu season. So we're going to have a lot of upper respiratory infections presenting itself this time of year, anywhere from about October, November, all the way through till about February, March. So it's a long season. And we're going to find things like runny nose, sneezing, itchy nose, watery eyes, cough, achy bodies, what we call malaise, just fatigue. But then you get into bronchitis, and there can be definitely viral or bacterial bronchitis, depending on what's going on, and it can progress to pneumonia. And viral pneumonia versus bacterial. Bacterial types of infections obviously respond to antibiotics, but the viral infections are the ones that we have a hard time fighting because there's not much treatment. I mean, for flu, we have a few medications that can help decrease your symptoms and or possibly prevent you from getting much, much worse if you take it early in the first, 2 days or so when your symptoms are mild. But when you get into something as significant as a pneumonia, and whether it be viral or bacterial, it can be very serious to the point where, like Danielle said, if you get on a ventilator, it's really touch and go whether or not you get off of it and or even get out the ICU at all. So bacterial pneumonias, sometimes you do well enough if you catch it early enough and get on antibiotics, 2 and 3 of them sometimes. But it really depends on how well your body has been prepared throughout the time, your whole immune system, if you're going to handle it well enough for that long fight. Your body has to fight for the next, 7-10 days or more, depending on how long it takes. So I would just say that, I'm begging everyone to get a flu vaccine. Even the non-believers need to, at this point, sort out between flu and COVID-19 so that we can have a fighting chance to help you along the way. If we know that your symptoms are coming in and they're very mild and it looks like flu, great. But obviously, if it progresses, then you take a nosedive very quickly with respiratory problems, shortness of breath, difficulty breathing, those types of things, or your lips are starting to turn blue because you're not getting good oxygenation. Obviously, you need to get help. But I would just say if people can at least get vaccinated with the flu vaccine, that at least decreases our chances of having more demand on our healthcare system so that we can save those beds for the sicker patients with COVID-19 that are coming in and give them a fighting chance to survive.
Okay. Wow, that's really great. Great information. Thank you for sharing, even about the lips turning, you said blue or purple, right? So that's another sign of that. Are there any so one of the prevention measures you gave us is to get a flu vaccination. So thank you for sharing that, your professional expertise in this area. Is there any other like either home remedy or things that we could do to try to help increase our immune system during this season, Dr. Afllalo?
Yeah, and Joanne mentioned it earlier. Some of the supplements, obviously vitamin C and zinc, and vitamin D for sure to help fight off some of the other types of things. Anything that's going to boost your immune system. I actually prefer to go even to diet. The more colorful veggies, fruits and veggies, the purples, the oranges, the reds, anything along those lines have a lot of antioxidants, which helps to fight off a lot of the free radicals that's going to damage the cells. The cells are, your immune response is really in response to how your body can handle it. If you can keep your immune system up with a good diet. So the more colorful your diet, the better, with fruits and veggies, and then all the additional supplements, vitamins and minerals. And like I said, Joanne really mentioned quite a few of those. So people don't necessarily do that, but there's no harm in starting now.
Right.
So if your immune system's not all that great right now, before you expose yourself to something, go ahead and get started. Buy some supplements and buy some colorful types of fruits and veggies, and by all means, and take those in every single day, and that will be helpful.
So some of those colorful fruit and veggies, would you say like carrots, beets, those are colorful? I'm trying to think, spinach.
Yeah, and the blueberries, the strawberries, things like
I love
that.
those.
fruits and your veggies, those types of things, the more colorful, the better.
Okay. All right. Awesome. Anyone else have any other thoughts on that, or any other additional tips? Because we want to make sure we help our community, right? And give as much information as we possibly can. So one of the other questions that I would like to ask you is, well, before I get into another question, I'm just really curious in general, and I think you already touched on it, Dr. Afllalo, is why are we here again? Is it because we politicized this mask wearing and, washing hands to people felt like, it was infringing on their freedoms? Is that why we're at this surge again at this time of the year? It's because when you go out, it almost looks like it never happened, right? How you see people socializing. I mean, I remember when it was supposed to only be like 25% in restaurants, and I can drive by and I'm like, oh my God, look at all those people in there, right? So I just want to hear you guys' thoughts on this. Is that the reason why we're here now?
Well, I'll start off just a little bit and let the other young ladies fill in. Is that, yeah, I think some people never took it seriously. And then there's a population that did really crack down when Gavin Newsom, our governor, say stay-at-home measures for a few weeks in advance, and people did a good job. And we were California was very successful for those first couple of months to kind of keep things under bay. But then we made the mistake of opening up places in holiday season, Memorial Day, 4th of July, then Memorial Day, and then Labor Day. And we lost our priorities. We shouldn't have been opening up beaches, and we shouldn't have been opening up bars and restaurants. We should have really, now that's why we can't open up our schools, because our priorities are screwed up. And so instead of trying to make people happy by allowing them to go out and socialize at a bar where you close distance with no mask on and spitting at each other, talking loud and that sort of thing, and you're spraying all these droplets and aerosol, that we just lost our way. And then some people just never took it seriously. They never stopped getting together with their friends, and then they took it home to the other families, and that's how it spread. It's an exponential problem. So the few people that get it can spread it to quite a few people. But the biggest thing is, if they're asymptomatic, they don't even realize that they're passing this death sentence on to other people. So that's really the problem.
Okay, great. Thank you. Yes, Joanne and Danielle, can you also chime in on that?
Yes, absolutely. Another thing we know is that the virus that we see right now is a little bit different than what we saw at the beginning of the pandemic. We know it's mutated a few times. And I know there was a study that came out maybe a few weeks ago that said that this particular strain of the virus has what's called the D614G gene, and that's how it's mutated. And this one tends to be a little bit more virulent, meaning that we tend to have higher viral loads of COVID-19 with this mutation in our nasal pharynx area. So it's highly more transmissible to others. So that, on top of just the behaviors that we haven't adapted to, just added to a slippery slope.
Wow. Yeah, that's very significant. Joanne, any other thoughts on that?
I think we lost our way with the COVID-19 fatigue. I think we want to call it fatigue, as in we just had gotten so tired of social distancing and so tired of not seeing our family and friends, and just the kind of, fatigue of it all, and just kind of throwing caution to the wind. And I think that, again, came from our leadership, seeing the people in leadership not following the rules themselves. Well, why should I follow them? So I think, along with, not having good examples, as well as the fatigue of it all, I mean, it's been 9 months, and I myself am tired. I haven't missed a day of work. I see 25 patients a day. Most of them, we're starting to see more patients in clinic versus telephonically, but I'm tired. I would like to, not work so hard. I have not missed a day of work. And I have had colleagues around me get sick, but the fact of the matter is, it is fatiguing. It is tiring that we're still having to endure this. But, as the scripture says, we have to endure hardness like a soldier. We've got to keep doing this so that we can make it to where we're free from, from all of the consequences of the disease.
Yeah, so I definitely appreciate everything you guys shared. And so, Joanne, even what you're saying, I mean, the fatigue of it is, and what Dr. Afllalo was saying, priorities, right? So it was more important for us to go to the beach, like you said, than make sure that it's safe for our children, can go to school. I mean, that's, I think, poor decision-making, right? And so one of the things I remember learning even when I was in elementary, how much the United States is more from a society, was more about the individualism than the collectivism, right? And so it seems like with, even Dr. Afllalo explaining what the pandemic means, which is worldwide, not just one, exclusive area, that we really need to shift our paradigm and understanding that our actions, how that is impactful to our collective community, not just us individually. And so I think, there is a societal shift that is, it's presenting itself as an opportunity for us to consider, our fellow man, our neighbors, and not just us individually. So thank you so much for sharing this information. So now, Dr. Afllalo, I definitely want to ask your opinion and your thoughts as it's related to the vaccine, right? And I want to get your professional thoughts on it. Should we take it, or, is it something we need to wait to see about any possible effects that could happen to our health before it? What's the risk of us not taking a vaccine? We know that it's not on the market yet, but they're working on it. Can you share your professional opinion to us for our community on the vaccine?
Was that question for me? I'm sorry, because I missed it.
Yeah,
okay,
yeah,
I'm sorry. My phone kind of blocked out for a second. Yes. So in terms of the vaccine, wow, where do I start? I have to admit that, once again, because it seems politicized, it has been a true turnoff to the majority of people that might have even been willing to promote it. But at the end of the day, let me just say that without a vaccine, we're never going to get past this. So the vaccine is very important. The part that's confusing is for a population like African Americans or minorities who are non-trusting or have a huge distrust for the healthcare system anyway, once you add the political lens to it, and it really does tarnish whatever hope we had of getting people to participate. So all I can say is that it is going to be necessary. The manufacturers are, and the studies are coming along. Unfortunately, we may not have as many people, Black and brown people, participate in it to really give us a good sense of whether or not it's going to be effective in the Black and brown community and people with comorbidity diseases. But we're going to have to spend some time to build trust and get the right messengers out in our community to let them know when we feel it's the right time to do it. Because I mean, I'm not for it right now because it feels like it's been a rush job. And so when someone approached me from UCSD to say, hey, Dr. Afllalo, can you help us kind of connect, with the community so we can, talk about this vaccine? I'm like, whoa, time out. Because you want us to do this in like 6 weeks? It ain't gonna happen in the Black community. Okay.
Thank you, Dr. Afllalo.
Right.
So she's a champion for us, y'all. And I'm so glad you're keeping it 100, like you keeping it real. So I appreciate that. Because not everything we've been thinking. We have historically, unfortunately, right? Like you said, it's not mistrust because we're paranoid, it's mistrust because historically the things that's happened to us, right? As a community here in this country, so.
Right. We really do have to protect our community from the outsiders that want to come and use us and then go back out and use the data to do something. So if they were going to be, they need to be upfront and honest. But it unfortunately came out with this warp speed stuff, and they wanted it done yesterday. And you have to approach this type of seriousness with the utmost respect. So the people, you need to come into the community, have a conversation with them, have town halls, let them ask questions, answer questions, really get them to develop a set of trust, that you're doing the right things for the right reasons. So at this point, we started off wrong out the gate. It's going to take that much longer to convince our people that it's necessary and that it's safe. So I'm not even sure if it's safe yet, because we have a very small population of Black and brown people in the studies. So it may work great for white folks that have no underlying medical conditions. We don't know if it works for kids. We don't know if it works for the adults. We don't know if it works for Black folks with 3 medical conditions. So, I don't know what to tell folks, but I'm not going to get into a study right now. And the fact that it was pushed. And then what I'd say is that once we do find out it is safe enough, I'm going to encourage people to get it, because that's the only way we're going to stop dying from it. We're disproportionately affected by it. And we have to make sure that we can get it, and we're in the front of the line once it's safe enough to make sure that we can get it. So I have mixed emotions about it. Had we had it done properly, and the CDC and all the other NIH and all the people are sending the right messages, and it wasn't tainted by upper administration, we would have had a smoother rollout, and we would have had honest information, transparent information from the beginning, instead of mixed messages from the entities that we trusted, the organizations that we trusted. And so we made a mess of things once again, and it all bubbles up to the top of leadership. Right. And so had he not put his finger, weighed in on this, and let the scientists and the virologists and everyone do the right thing, and just let them lead it, and Dr. Fauci's and all of them telling us honestly what to do and how to do it, and asking the entire nation to please wear masks and do this, and within a period of time we can get past this. I'm sure if we could have filtered all the nonsense out, we've been further along the way. And when the vaccine is ready to come out, I think the people would have been a little bit more likely to trust it, especially if the other trusted messengers from the community said, yes, this sounds like a good thing, and I'm willing to go and get it myself.
Thank you. So I also just had another question. I'm sure a lot of people in our communities and in all communities are having these thoughts or questions, or someone else besides me, I'm sure, is how long does it normally take, after a study is done, to even find out the impact it can have on your health later on? And I'm going to make an example. I remember Gardasil being pushed really heavily for young boys and girls, boys as well, under a particular age, right? And I remember even at the time, my primary, care doctor and my sons really pushing it as well. And then, 10 years later or so, now you're hearing that it can have, young men can, develop different, hormones in their bodies, or, different impacts on your health, even though at the time it was pushed very strongly, the reasons why you wanted to try to avoid something else. So my question is, how long after you even have it on the market and testing are all of the effects even determined, for that matter? Dr. Afllalo?
Oh, okay, yes. So to be honest with you, the study, this particular for the COVID-19 vaccine, the trials from AstraZeneca and all the other ones that are coming down the pike. And let me let you know, there's about 135 vaccines that are being developed over various countries. So we've got about 4 in the San Diego area, and there's more coming. Every few weeks, there's a few more coming as they get further along in their phase 1, 2, 3 trials. But the studies right now they follow you on for about 2 years, and consistently, right? So you get a vaccine at day 1, and about 28 days later, you get the booster vaccine, and then they follow you 2, 6, 8 months, whatever it is. They have a set of criteria. And then about 2 years, or a little over 2 years, is when they kind of draw their overall conclusions. And that's after in the phase 3 trial. The problem is that we barely touched the phase 3 trial. We have small numbers, and they're ready to push it out now. We haven't even gone past 6 months for a lot of them. We don't have enough data. But if they don't see that people have, grown horns and died from it, they're willing to push it out now. So what I'm saying is that we even have an EUA they passed, I believe, with Pfizer to say, and that's an emergency use authorization for one particular one to start being pushed out. We haven't done enough studies, and the numbers are small to determine whether or not anyone's really going to be negatively impacted and how safe it is and how effective it is. So they say 90% effective of what? And who did they test it in? So, they're very vague. I mean, you throw out 90%, it sounds wonderful. Oh yeah, this is great. I'm excited. I'm not getting in that line, okay? Because 90% of what? And how long have you been watching it to see what else comes up later? So yes, even after they follow you for the 2+ years in any study, whatever it is, there can always be side effects and untoward consequences even further out. So nobody knows that answer.
Yeah. Thank you. Thank you for sharing that. And Joanne and Danielle, did you have any thoughts or wanted to weigh in on that topic as well?
I would say there's a reason why it takes roughly 18 months for something to develop. There's a reason. We have animal studies and then human trials and then various forms of the trials. I just think that to piggyback off of what we were talking about globally, Americans, our nation is so self-centered. We have other people in the world who are also working on this. We're not the best at everything. We are not the best at everything. And
go ahead and say it, sis.
We have to take advice and the lead from other countries, other scientists in the world. We are so self-centered here in the United States to think that we know everything. We don't know everything. And so to allow other countries to participate and to be a contributor and to use their data is valuable. I'm with you, Dr. Afllalo. I'm totally looking sideways at this vaccine, and until such time as I feel confident that it is actually something viable, I myself will not be participating, and I will not encourage anyone that I love to do so either. So I just say we need to pump our brakes, and while we got our foot on the brakes, we need to do what we need to do: social distance, wash your hands, wear a face covering, forego these holiday gatherings, do the right thing.
Yeah. No, you're bringing up a good point, and especially when you're saying where America's so arrogant, right? I mean, you didn't say that word, but that's kind of my interpretation of it. That we're so arrogant that we think that, obviously we're not doing it all right here, as Dr. Afllalo mentioned, how we have, other countries around the world that actually have been able to contain this pandemic, and it's not as impactful in their communities. Danielle, I wanted to give you an opportunity to chime in. And then I also have a question. Oh, I think, question is coming in also from some of our viewers.
Yes, I agree with everything the lady stated. I too am looking sideways at this vaccine, and wondering, who are in the trial studies, what are their demographics, what are their race, their ages, what chronic diseases they have. So we want to see the data. It's extremely frustrating to turn on the news and hear, oh, this vaccine has this percentage of accuracy. And it's like, we haven't even had enough time. And really the game is set to now. Now we're seeing our numbers greatly increase. How is the vaccine going to hold up in this case? And to piggyback off of what Joanne just said, I would like to see us talk more about, how interferon is playing a part of this, what Cuba is doing. We know that interferons are from our body's own immune system.
No, I don't. Can you explain what that is? Because sis, y'all the professionals, we're trying to learn. So can you please explain what that is?
Absolutely. So interferons are part of our immune system. Our immune system, when we come into contact with a virus or bacteria, it says, hey, you don't belong here, right? We need to get rid of you. So they bring in all the big guns to basically eat it away, kill it, and so that, you know, your body can fight off that infection. Interferons play a role in making sure that viruses don't replicate. We know that Cuba is using a medication that uses interferons, but, you know, it would be nice to lift an embargo and talk with these other countries because their rates are much better than ours. So we have to get over ourselves as American country and learn to partner with other places around the globe who are doing it better.
Thank you so much. So we do have a question coming in from some of our viewers. And so I would like to ask our panel, and I definitely, Dr. Afllalo, I know you're on so many task force and very heavily engaged in stopping the COVID-19 in our communities. So the question is stated that in the beginning, there was an issue on obtaining metrics for communities of color, and that currently that information is not now being shared throughout the news. So we're not hearing about that anymore. So is there any issues right now about obtaining stratified demographic information as it relates to the COVID infection and the COVID infection rates still an issue for the Black community? Like in the beginning, we were hearing different demographics and information about us, and we're not hearing about it anymore. Do you know if that's still an issue?
Okay, so as it, yes, in terms of the metrics, let me just explain that. The county is kind of tough because the county reports out what's given to them. They're kind of the hub of the data. So where there's clinics and hospitals and side places that are doing the actual testing, COVID-19 testing, they send information there. Well, if you don't get information from these sites that have demographics associated with it, data in, data out, junk in, junk out. So what it means is that if you just get data saying I have, you know, I did 30 tests today and I have 2 African-Americans and you don't have demographics for others, all you can do is report what you get. So the county was having a hard time with that. The California has now mandated that they gather more demographics as they do the testing so that when these other sites test with it and have the demographics, they can now send it over to the county so they can compile the data together, aggregate it together and report it out. They have gotten better. The task force has pushed them, along with a few other entities, have pushed them to get better data and to also disaggregate it, meaning not just lump all Asians in, but try to figure out, you know, which population is Filipino, you know, which population is Native American, that sort of thing. So really parse it out. We still have a large percentage, 15, 20% that are unknown. And so we don't know how many of those are African Americans. In San Diego, our numbers are very small for the Black population, which confuses me. But it could be that some people are just not reporting because you can't force them to answer that question. But there were other people that were testing that weren't even asking the question. So now I do believe we're getting better at reporting it out. And the county has now even broken it down into the actual people that are tested and tested positive for the actual demographics. So they have gotten better, but it's been with a push. And we even had a meeting with Dr. Wooten the other night, about 20 of us, regarding, you know, how do we get this? And she explained that her hands are tied. If these entities don't send in the information that has the demographics, they can't create it. And they can try to also call when they have to do case investigations. They can certainly ask at that level. It's gotten better, but still not where we want it.
Okay. Thank you. And thank you, viewer, for asking the question. So now I mean, it's holiday season, right? And this is the first time in our lifetime that we are, you know, going to have holidays. You know, Thanksgiving is going to come, Christmas, New Year's is going to come, but we're in a pandemic, which Dr. Afllalo did a very good job explaining it, meaning it's everywhere, right? It's not just here in your local community, in your own little state or what have you, or own country. It's global. So Dr. Afllalo, I really want to get your professional advice, as well as our beautiful celebratory nurse practitioners, and this is Nurse Practitioner Week. I mean, I'm so glad that you guys have been able to join us as well. But I kind of want to know is, what is the best way that we can celebrate, you know, our traditional holidays in the midst of a pandemic?
Well, it won't be traditional, period. If you want to stay alive, if you want to see your family member and
it's not traditional.
Yeah, if you want to do a traditional one, stay away from each other this year so you can have a traditional one next year. So my suggestion to you is to, basically, if you want, you can Zoom. You guys can all cook at home and Zoom and enjoy each other's company and laugh and joke that way. If someone's cooking a big meal, you guys can come by and pick up a meal like you do a drive-by, pick up a meal, that sort of thing. And if really there's a few people in your family that you definitely want to see and it's not more than maybe 2 households, I suggest that everyone get tested and get their results before they come into that household. And so, if you really can't avoid it because you need to check on grandma because you're not sure how, if she's gonna make it the next handful of months, do yourself a favor and your family a favor, go and get tested. Make sure you're negative before you come in there. And I would still keep distance and that sort of thing. But my suggestion is do not get together with your family. Do not give them a death sentence. If you love them, stay away from them.
Wow. I mean, thank you, Dr. Afllalo. And so the verdict is in on that. Joanne, did you also want to chime in on that?
I would also add, just like you said, if you must gather outside, if you go to a park, a backyard gathering with as few people as possible, but also maintaining your social distance and also wearing your mask. I mean, is it worth it? Or everybody Zoom? Hey, we can do a Zoom Thanksgiving. I mean, is it really worth it? Is it really worth giving grandma or your uncle, COVID and watching them suffer? It's not.
So I did hear, Dr. Afllalo, I thought it was either you or Joanne, one of my, professional medical professional friends mentioned about having it like 3 families or less together. Who shared that with me? Dr. Afllalo said it wasn't me.
That was the recommendation, I believe, from the county a couple of weeks back, but that was before we got into the purple tier. So it's gotten even more dangerous. And that was the recommendation, no more than 3 separate households coming together. But I would not recommend that. I wouldn't recommend more than, just your own household getting together. Because you have people that go out, they're frontline workers, they come back in, they're still putting you at risk. So I would not, but if it's a desperation, I say get tested. And then like Joanne said, do the outside, it's a little cold, but do the outside thing. Do the distance thing, wear your mask until you eat, and y'all take a plate in different rooms and eat if you need to, but it's not worth it. It really isn't worth it.
So, I mean, I guess I'll just have to be dropped. I mean, I guess Elijah's just going where he's going because I mentioned it to him. I said, well, and I thought you said it, Dr. Afllalo, so my excuse. I said, he said only like 3 households or less. And he's like, well, Mom, I'm going. I'm like, so. All right, so anybody else want to chime in on this? Danielle, we didn't hear from you on what do we do for the holidays?
I think we just have to continue to be creative and continue not to gather together. I want to applaud the people that are being creative and wearing their mask. I've seen some interesting birthday celebrations where they're outside. Everyone wears their mask. To blow out the candle, we wave a plate instead of blowing out the candle. So there's different creative things and different creative ways that we can still gather, but do it safely. So if it needs to be a Zoom call just to get that fixed in, because I know holiday seasons, we think about family, then it's a sacrifice so that next Thanksgiving we can actually get together.
Right. And I think one of the terms we've been using is social distancing. And I heard it early on that actually is not necessarily should be the accurate term. It should be physical distancing because we could still be social, as you guys are mentioning, through Zoom and other, creative ways that, we can use the technology to still be social with one another, but just physically distance for safe precautions. So now that we're almost, I can't even say we're out the woods, right? Because this pandemic is like becoming more and more relevant. The numbers today are more astronomical than they were, in March and April, right? When we did have like a full shutdown and, the earth literally just had to have a strong pause moment. What does 2021 look like? Dr. Afllalo and the rest of the panel, please do you guys have any insight? We know going into 2021, we're probably still going to deal with this, but is there a light at the end of the tunnel by any means?
I do think there is a light at the end of the tunnel. I think new administration putting in some national orders in place, making the things that we need, making more N95 masks and things like that to really allow people to stay safe, especially our healthcare workers, but also, mandating mask wearing, and maybe in certain places, the states can shut down places where they need to. I'm concerned that if you shut down the entire nation, that there's going to be an uproar, because we've got enough crazy people that would want to come out and protest. But I see a vaccine coming into play. I do feel like at some point it will be effective enough that we can use it. It's going to be more in the summer, where there's going to be enough made that to allow people to get vaccinated, because vaccinating a small portion of the population does nothing. You have to have herd immunity, not by killing each other and spreading it, but by vaccinating everyone. So I do feel like there is some time, but it's going to be another 6 months down the road before we see any kind of change. So the basic things that we can do to keep ourselves safe until those heroic measures come into place is to continue doing all the things that we've been saying, and that is wear a mask, wash your hands, keep your distance, physical distance, 6 foot distance, and avoid just going out if you can. I mean, at this point, until we're able to get together safely.
So I am getting a little bit more encouraged, as you just mentioned, the vaccine again, because before we talked about it was a little dark, right? So because we have the vaccination for like polio, chickenpox, and things like that, that has helped, right? Measles and the mumps, all kinds of diseases that once upon a time would be fatal to, so many people are now is part of our just cocktail of vaccinations that we get, our babies get, and don't receive it. So Joanne, Danielle, let's start with Danielle, then Joanne, I'll let you kind of wrap us up. What are your thoughts about 2021? Anything else you want to share? You have your new clinic coming open. If you want to shout out your innovative wellness clinic.
Yes, absolutely. Thank you for that opportunity. So right now, our economy is not doing great. Many have lost jobs, many have lost health insurance, but this is really not the time to let our health decline as we see the pandemic is getting worse. So, I would like to offer an opportunity to continue to take care of health. You can check us out at Innovative Wellness Clinic. We're a nursing corporation. We should be open by next month, but we do direct primary care. So we don't accept insurance, but we allow you to pay with cash-based services so that we can still get you discounted on medications, discount on labs. You still get the same quality care from a provider, and you're still checking in on your healthcare. That way there's other options while we're in the transition period during employment and things of that such.
That is amazing. Our community needs it. Many communities need it. Thank you, thank you, thank you for having the vision, the leadership, and the guts to get out there and to serve us. So really appreciate you, Health Avenger. Joanne, would you like to share your thoughts on how we're looking forward in 2021 and our health in general?
I'm hopefully optimistic, but cautious at the same time.
Yeah.
I like Dr. Afllalo said, 6 months down the road, we may have a little more freedom, a little more leeway. I see better health on the horizon, but right now we're in the trenches. And while we're in the trenches, we've got to dig in and we've got to do the work so that we can get to the place where we have the freedom, where we have a little bit of ease. And, we just got to do what we got to do right now so that we can do better later, sacrifice now, reward later.
I love it. Thank you, Joanne. So Dr. Afllalo, definitely want to give you an opportunity just to sum us up, give us the messages you want our community to know, to hear here locally, as well as those listening across the country, right? As well as abroad. So let us know your thoughts as we're moving forward. And we do have one other question. Someone asked if they're taking vitamin D, that's 50,000, looks like 50,000 mgs vitamin D. Is that too much? So I know you always are up to help somebody with their medical. So we want to make sure we can answer that question as well as you kind of give us your thoughts and visions for the future.
Sure. The 50,000 units sounds like somebody prescribed that to them for a short period of time, probably for once a week for the next 8 to 12 weeks to get their D level up. Yep. And then after that to probably take at least 2,000 international units each day. So that's not something you would take on a regular basis, but it is to boost them up. They probably were very low, probably less than 10 on their vitamin D level. That's a normal prescription for us. But I would say just in summary that the most important thing right now is we have to take this one day at a time. We're at the worst point of this pandemic right now with the highest numbers. This country is the one that's suffering the most out of all countries. I am hopeful for new leadership, which they've already gotten their task force together. So they're serious about taking this pandemic serious. And so they're going to trust science. They're going to trust the physicians that are involved, the virologists, the epidemiologists, to do the right thing, and they're going to follow their lead. So I think we're going to be back on track, which will allow us in 6 to 8 months to really feel like we can win back the country's trust in the entities that we need to be able to get a good, clear message. But in the interim, continue doing the same measures that we spoke about. Get your flu vaccine. Keep the distance as much as possible so we don't infect each other. And I would suggest getting tested and getting tested often, because that's one of the factors that keeps us out of the purple tier, is to get tested. So if you get tested and we can isolate who's asymptomatic, we can isolate them. And we do have in San Diego, we do have, free hotel lodging and services associated with that, surrounding circumstances. But I would just say that if we can test, we'll know who needs to be isolated and how we can keep going along with our day-to-day life. So I recommend testing for COVID-19 as often as possible.
So how often? I know I had a test probably a few weeks ago. Thank God it came back negative, but just to make sure that our viewers and even myself can follow the doctor's orders. So how often would you recommend that we get tested?
I think it just depends on what you're doing. I mean, I'm staying home 90% of the time, so I don't have to test every week. But the point is that, because I take care of a 91-year-old, so I have to really minimize the amount of exposure that I have. But I would just say that if you're a frontline worker and you're out there dealing with the community, that I would say once every 2 weeks or once a week, depending on it. I mean, we have our SDSU students that are getting tested every 2 weeks regardless. And so there's no harm in testing at least a minimal of, say, of every 2 weeks if you're out in the community. And once a week if you feel like you got some exposure, undue exposure.
Right.
It's free. Go get tested.
It's free, y'all. So go get tested. Thank you so much. Go ahead.
I'd like to piggyback off of what Dr. Afllalo was saying about the measures, but also remembering cleanliness in your home. I know for a while we were missing things like Clorox wipes and Lysol, doorknobs, light switches, any place where your hands touch, those places need to be cleaned on a regular basis, just to make sure that we decrease the transmission of any germs, any bacteria, any viruses, cold, flu, COVID-19, all of that. Just making sure that you're keeping things tidy, the steering wheel in your car door, the gear shift, like these are things that you touch all the time, your cell phone, like these are the things that you need to remember to continue to wipe down on a regular basis.
Thank you. Yeah, thank you for that reminder. So we have our health Avengers, y'all. So they are giving us our tips to make sure that we sustain a more healthy life, and so that we're here and we're not transmitting anything to our loved ones. So I want to thank our nurse practitioner, and happy Nurse Practitioner Week to Miss Joanne Goode. And we have our nurse practitioner, Danielle Gordon. Thank you for joining us, and happy Nurse Practitioner Week. And our Shiro community leader, Shiro Avenger, Dr. Afllalo, one of my dear loves. Thank you so much for joining us, and looking out for next week, you guys, on Sustainable Urban Network. Thank you for joining us. We'll see you later. Bye-bye.